My name is Dr. Diana Mariam. I'm the Kenya Medical Association Secretary General, and with us is our team, that is the Kenya Medical Association leadership and our international guests from Africa that are here for one very important reason. We've had challenges trying to really achieve UHC, and this is in the direction of really bridging that gap between policy and practice. So we tend to have very good policies, but now where we have a problem is how to integrate that and make them work for our citizens.
Naitwa Daktari Simon Kigondu, ndiye rais wa chama cha madaktari cha Kenya, Kenya Medical Association. Leo mko katika kongamano la madaktari la 52 la Kenya Medical Association, na katika kongamano hili mengi yamesemwa. Serikali kuu ipeleke pesa zaidi katika ile inaitwa County Revenue Sharing Fund katika makaunti, ili makaunti ziongeze pesa ambazo wanapea katika sekta ya afya ili watu wapate kutibiwa zaidi. Na pia tunauliza ya kwamba KEMSA ifanye kazi vizuri ili madawa na mambo ambayo yanahitajika katika matibabu yaweze kuwa hayako na bei kali, na hospitali na zahanati ziwe na hizi vitu.
Deliver quality healthcare to Kenyans, but without necessarily causing a lot of problems in terms of costs. And we've looked at various interventions that have been put in place, and we have a lot of policies. The UHC is a very important policy, but how we bridge that so that we can be able to save lives and improve outcomes is what we have not achieved yet. And we've been here and we've been discussing important discussions around how to be able to bridge that. And a lot of things have come up that are very important. This includes collaborations between various sectors. And here we have the public and the private. That we had a big problem when our donors withdrew. That's our major donors in health withdrew their funds. And therefore we really need to think very clearly on how we are still going to bridge that gap and finance healthcare as it should. We have also been able to see how we should be able to have accountability systems that are able to ensure that our resources are well utilized and they're actually available to deliver the services that Kenyans need. Beyond that, we've been able to also look at the role of digital health and how that is going to increase efficiency. And so far the discussions are ongoing, and at the end of this meeting we are looking forward to delivering briefs that should be able to influence the implementation of policy.
At the human resources for health level, we want to see good measurements. We want to see that the KMPDC is allowed to ensure that the entry into University of Doctors is not just a business by universities. So those are things that we want to see more people employed and promoted as they should. At the health information systems, we want to see information systems deployed to improve efficiencies and recording of the output of work. At the commodity level, we want to see KEMSA and other suppliers stocked so that public facilities can be well facilitated, so that health service delivery eventually is good. In terms of funding, healthcare financing, as we have said, donors may go, but it is upon us to fund ourselves. And the Social Health Authority, which a member of the board is a KMA member, one of the board members, has been structured so as to try to get funding for the health sector. There is the Primary Healthcare Fund and the Emergency and Chronic and Critical Illness Fund, which we must push the government to fund. At the end of the day, you want that patient who goes to the health facility to find the highest qualified personnel, to provide the highest quality of treatment, to get the best quality medication and walk out there without enduring financial distress. We advocate for all these things. We look at counties that have done well and ask other counties that may need to copy those counties. We look, do they have good governance? And at the top there is governance which allows the health